Hello everyone, welcome to another session in medical education series, that is teaching. Myself Dr. Tushar Kalra, MD Community Medicine. So let's begin our session. So our specific learning objectives are to define the teaching, to enumerate the qualities of a teacher, learn what to teach and how to teach, and systems approach to teaching. Definition. So teaching is an interaction between the teacher and students under the foremost guidance, that is teacher, in order to bring about the expected change in the latter's behavior. So teaching is a process is intended for learning purpose. Then what is the purpose of teaching? It is to develop the interest in the student, develop proper lifelong learning habits, acquire, apply knowledge, and achieving skills and use them with the confidence. Now what are the qualities of a teacher, of a good teacher? That is, he should have a subject expertise, he should be willingness to teach, he should be able to motivate the learners, he should have basic organizational and managerial skills, ability to communicate and explain, ability to provide developmental feedback, and understand of how people learn. नेक्स्ट इज टीचिंग मटेरियल. सो कोई भी मटेरियल होता है, कोई भी सब्जेक्ट होता है, उसमें एक कोर पार्ट होता है, एसेंशियल एंड डिजायरेबल. कोर पार्ट क्या होता है? द स्टूडेंट मस्ट नो दिस पार्ट. एंड एसेंशियल होता है दे शुड नो, एंड डिजायरेबल इज नाइस टू नो. नाउ सिस्टम्स अप्रोच क्या होता है? तो एक सिस्टम क्या होता है? इट इज एन एंटिटी ऑफ इंटरडिपेंडेंट कंपोनेंट्स विच इन्फ्लुएंस एंड गेट इन्फ्लुएंस बाय ईच अदर. So for example, systems approach first होगा, हम input देंगे in the form of lectures, then there will be the mental processing by the student, and there will be a change in the behavior of the student. Now systems approach, it tells us that teaching, learning and assessment are part of systems, and change in any of them is bound to produce a change in the other. It helps us in designing an efficient teaching and learning process, and there is a concept of backward planning in this. So beginning with the end in the mind, so we should begin with the end in the mind. For example, in competency based medical education, it begins by first listing the competencies the graduate should have, and then we work backward on what teaching and learning method should be there, what should be the best teaching and learning method. Now for example of system approach, so what will the learners be able to do at the end of the course? Okay, then how will we know that he can do it? What learning resources we are required, and how will we use these learning resources, and how will we assess them? Now what are the benefits of systems approach? It gives us the clarity of objectives of the course, deciding an appropriate assessment method, selecting appropriate resources, and allow us to use assessment to modify the system. My references for these slides are Principles of Medical Education and Satkinji et al. Thank you everyone.